Good afternoon, Team QualiMed. Thank you very much for being with us this afternoon and welcome to the first QualiMed OSH or Occupational Safety and Health webinar series. And we are going to have our session 1 today. And the title of this session is End TB, Workplace Policies and Program on Tuberculosis. So this afternoon, we will have a lecture from our Santa Rosa Hospital. And I hope everybody is okay and well today. And please ask in your friends and your colleagues to join us this session. All employees are required to attend our session as part of our TB session in our webinar series on several issues that we need to be that we need to know also. All right, so just some few reminders, guys, on today's session. Hold it. Okay. So some for your reminders, when you for questions, you can just post your questions at the chat box, as you already know, for the many webinars that we've already done. You may also raise your hands if you want to verbally ask the question during the Q&A portion of the session. So, and if we can also request everybody to rename your names in Zoom, beginning with your SBU, para we can also acknowledge your SBU's attendance. All right. Also, for everybody, if you cannot join in Zoom, this is also streamed live currently in our QHN Facebook account. So you can also ask our colleagues to listen in using that account. All right. So before I continue, let me introduce myself. I will be emceeing this afternoon's webinar. I am Bambi Picazo, your corporate training and OD manager. And this afternoon, I would like to also introduce, well, everybody knows her naman, to open and welcome everybody in this afternoon session. Let me introduce you guys to our OIC for VP HR, Attorney Nimu, to welcome all of us this afternoon.
I'm sure for most of us, we have been parang solely protecting ourselves from COVID-19 without realizing that the other infectious diseases still exist. So as we transition to the new normal, and thankfully with the decreasing cases of COVID, we are finally able to have time to go through this series, especially on occupational safety and health. As healthcare workers, we have a greater obligation to our colleagues and most especially to our patients to remain healthy in order for us to continue to serve them. TB incidence in the country, while decreasing, still continues to affect the health of 539 out of every 100,000 Filipinos. This is based on the World Bank records as of 2020. So I won't take much of your time. Allow me to thank our PSQMO team, led by our VP, Dr. Gina Nazareth, for helping us organize this. Thank you also, most especially to our medical experts who will be sharing their knowledge this afternoon, Dr. Marco Veracruz and our moderator, Dr. Araking, all from QualiMed Santa Rosa. So I am a proud
COO
member of QualiMed Santa Rosa. So yeah, thank you very much, everyone. And let's take advantage of this health series. Let us ensure that we complete the 4 sessions. And let's take full control of our health. Thank you. And yeah, let's listen, sit back and relax. Thank you. Thank you, Bambi.
Thank you very much, Attorney. Thank you very much. And that is right, because of the COVID, nakalimutan natin yung ibang diseases na meron pa. Hopefully, wala sa atin itong TB, but at least this information will help us also educate other people in our family and our friends, na at least these are nice information and good information for us to know and share to our families and friends. Ayan. So again, so for us to move on with the session, with this afternoon session, may I now introduce you guys to our moderator this afternoon. Our moderator this afternoon is a diplomate and a fellow of the Philippine College of Physicians and the Philippine College of Chest Physicians. She is also a proud member of the Internal Medicine Pulmonology Department of QualiMed Santa Rosa. Ladies and gentlemen, Team QualiMed, to introduce our lecturer, let us welcome our moderator, Dr. Arabella Pua-Quing. Dr. Arabella.
Hello, good afternoon, everyone, to our colleagues and all the staff of QualiMed. I'm going to introduce to you our speaker for this afternoon. He is a colleague and he is also a consultant here at QualiMed Santa Rosa. He is a fellow and diplomate of the Philippine College of Chest Physicians. Let us all welcome Dr. Marco Veracruz.
I was assigned to be given the topic about tuberculosis and in regards to our workplace, how can it promote decrease in productivity, of course, and it can easily spread this illness to other co-workers. So if someone in our manpower is will be acquiring this disease, of course, the decrease in workers will decrease into productivity, and sometimes yung mga naapektuhan na employee, due to the gravity of the illness, it will lead to resignation. So these are my objective. Number one, to present statistics of TB worldwide and in the Philippines, and of course, to discuss the pathophysiology of tuberculosis infection. And ito yung pinaka-important, is to adapt a workplace control guidelines. Okay. Just like I said before this COVID pandemic, there is still number one bacteria that's causing epidemic even before. So it's been centuries ago that tuberculosis was discovered. So right now, in the whole world, we have actually 10 million people affected that is actually having TB. So among those 10 million, 56% of them are male and 32% of them are female. And then let's not forget, there are also kids that are actually affected. And I would just like to include that it is actually increasing among patients who are having HIV. So 8.2% of patients with HIV are having tuberculosis. So, and then out of those population, 1.2 million of TB deaths among HIV negative people, and 208,000 of tuberculosis deaths among HIV positive. Here in the Philippines, we are ranked number 4, just like attorney have said before. We have an incidence of 599 per 100,000 population. So that this is in 2019. So we don't have the recent record about how are we doing in regards to TB, but in terms of the incidence, actually we are very high. And of course, I like to emphasize the impact of tuberculosis on businesses, on companies. So majority ng naapektuhan ng TB are active workers. Okay, so most of them are breadwinners, some of them are solo parents. So the problem is pag nagkasakit yung employee, of course, they will file a leave of absence, and then the manpower will go down, the productivity will go down due to slowing of workflow. So the problem, if some of the companies doesn't have parang Benefits, so sa iba is no work, no pay. So pag no work, walang sweldo, and paano yung family if the patient is actually acquired a severe tuberculosis? So, okay lang sana if we just have the mild sickness and then nothing to worry about. 74 Filipinos die of tuberculosis every day. So can you imagine the burden of tuberculosis is heavy among all our population? So it is not a disease that we can actually set aside. Okay, so this is silently killing our people. So it's decreasing our manpower, productivity, the workflow in our companies. So my next slide will be all about pathophysiology. So paano ba ang transmission? Paano bang nakukuha? Paano ba tayo nahahawa? Paano ba tayo nakakahawa? So let's debunk all of the fiction. So sobrang daming reason for having tuberculosis. So parang sa kliniko is halos lahat narinig ko na regarding dun sa pag sinasabi ko dun sa patient, meron kayong tuberculosis. Tapos ang dami lang reason for having it. So natuyuan ng pawis, uminom ng malamig, nahamugan, naambunan, nahawahan, namana sa nanay at tatay. So, I will give you a fact straight information kung paano tayo nahahawa ng TB. So, tuberculosis is the tuberculosis is meron siyang bacteria. It is caused by, the name is Mycobacterium tuberculosis. So meron tayong causative agent for having TB. So it is the Mycobacterium tuberculosis, siya ang nagko-cause ng infection through the lungs. Okay? So there is an organism that causes the disease. It primarily affects the lungs, and usually, but it's not actually defined as having a lung illness. It can go to different organ of the body. So marami ding pwedeng ma-affect ng tuberculosis. Just like I stated here in the picture, we can have bone tuberculosis, we can have intestine tuberculosis, heart TB, etc. So the transmission and symptoms. Okay, so paano ba natin natatransmit yung tuberculosis? So the tuberculosis is transmitted by inhalation. So nalalanghap. Ang TB po ay nalalanghap. So when someone umubo, sneezing, o kaya tumawa ng malakas, and that person is meron tuberculosis, and then na-inhale natin. So the primary organ that is affected is the lungs. So the Mycobacterium tuberculosis will go in the lungs. Pero ang tanong is, lahat ba ng nakakalanghap ng TB ay nagkakaroon ng sakit? Okay? So hindi lahat. As you can see in the picture, our immune system are playing a very important part para madepensahan yung ating katawan. So some of the infection are usually eradicated by our immune system before having the active disease. Okay? Pero since our immune system play a very important part in our defense, most of the other sickness like diabetes, HIV, and other illnesses that promote decrease in immune system, sila yung most prone and increase ang risk for having tuberculosis. Okay, what are the symptoms? Ano ba yung pwedeng maramdaman? So, these are the list of symptoms: cough, ubo, nang lagpas 2 linggo, night sweats, o minsan nilalagnat paghapon or gabi, masakit yung likod, pangangayayat, minsan nanghihina, or minsan pag yung dugo, ay yung phlegm is nagkaroon ng bahid ng dugo. So, maraming tatanong sa akin patients, Doc, lahat ba yan kailangan maramdaman before I could parang possible have a checkup. So it is not all or nothing, okay? So some of the patients have just minor symptoms. Some of the patients have just back pain. Some of the patient is having weight loss. Senior citizens, sometimes meron lang silang paghina sa pagkain. And then as to my next slide, I will explain further. So hindi po lahat ng symptoms na yan is needed for you to be diagnosed with tuberculosis. Okay, there is such thing as early infection, primary progressive active, and then the late. So ang i-highlight ko in this slide is the early infection. So pupunta tayo dun sa paano ba nag-start yung symptoms. Early infection, the immune system fights our infection. It usually proceeds, minsan wala pang nararamdaman at that time. So meron lang konting, minsan weakness, minsan lalagnatin, tapos minsan wala. And then if our immune system cannot handle the infection, pupunta tayo sa early primary progressive or active disease, in which yung ating immune system is hindi na siya nakayanan i-contain. So nagkakaroon na siya tayo ng symptoms that I stated before, just like fatigue, weight loss, fever, sometimes nagde-develop na yung cough. Okay? At this time, yung diagnosis is very difficult because sometimes yung ating symptoms is hindi pa katulad dun sa third column, which is the primary progressive, which is obvious na yung patient is something with lung problem. Pero most of the patients are asking if I diagnose them with tuberculosis, lahat sila is nagugulat. So ang sinasabi nila, Dok, wala naman ako masyadong maramdaman. Meron lang akong makati sa lalamunan or parang nagkakaroon lang ako ng low-grade temperature paggabi. And then when I lecture them about the Xray findings and then the illness itself, so marami pa rin sa ating hindi nakakaalam regarding do sa TB pathogenesis. Okay. In regards to TB infection, I would just like to highlight this because if a patient or a person doesn't have any risk factor, so the risk of acquiring tuberculosis is low, so 5% in the first 2 years. So I just want to emphasize, as you have many risk factors like diabetes and HIV, so the risk is actually doubling to 30% and much increase in patient with illnesses that decrease in immune system. So mas magkakaroon tayo ng active na sakit ng tuberculosis pag meron tayo ibang sakit, lalo na yung sakit na nagkukos ng pagbaba ng ating immune system. Okay, so I'm just finished on how to acquire the transmission, the symptoms of pathogenesis. I will go to the workplace TB control activities. Okay, so the main I would like to emphasize ito yung pinaka 3 general important aspect sa company, sa workplace. We need, number 1, to identify TB suspects. Sino ba sa ating mga empleyado ang merong symptoms at sino ba sa kanila ang suspecha natin for tuberculosis? Number 2, so pag nakita na natin at nalaman na natin kung sino yung suspects for TB, paano natin sila papagawa ng diagnostic exam to aid para to complete our diagnosis. And then after that we diagnose them for having tuberculosis, paano tayo makakatulong sa patient natin to complete their treatment. So the treatment for TB is unlike any other illness. So it's chronic, matagal. So 6 months. I will explain later the treatment period. So the screening among healthcare workers, usually it is a symptom surveillance. So most important is kung ano yung nararamdaman sa lahat ng health facilities. And then after may symptoms, we have to have a baseline chest X-ray. So kailangan ng X-ray followed by annual X-ray. So sa lahat ng employees, workers, so lagi tayo nag-annual chest X-ray just to screen patients who are actually suspects for tuberculosis. And then we have to orient, sensitize, and activity for healthcare workers. And ang important is all presumptive TB patients are asked for previous history and exposure. Minsan if they are newly hired, so nagkaroon na sila ng tuberculosis before, it is important na sabihin ng employees regarding the history of the treatment. Kasi mostly some of the people that having tuberculosis, they have fibrosis o peklat sa X-ray that needed by the office or the health and safety officer, and then we have to record. So after identifying the symptoms, the X-ray finding will be oriented and needed to be referred, of course, in our sa QualiMed, our house doctors, to be checked for possible tuberculosis. So the screening among healthcare workers, the baseline screening when the staff is recruited, so needed TB symptoms, and then number 2 is an X-ray. So just like I explained before, cough, unexplained fever, weight loss, night sweats, and then coupled with an X-ray. So the X-ray can be followed up by annually, and then screening will be annually. Usually same pa rin, symptoms and then chest X-ray. If merong symptoms and then the X-ray have an abnormality, so that's the time that we have to collect for sputum studies. Okay, so we have to collect for sputum gene expert, or for smear microscopy or TB lamp. And then the next slide, I would just like to emphasize that all of the employees or all of the healthcare workers or employees are not required to undergo tuberculin skin test. I'm talking about adult population, so I'm not talking about pediatric. Because some of my patients, actually, it is a real story. They have no symptoms, they have normal chest X-ray, but the problem is they have positive skin test. I don't know why is it required in their company. So they come to me, pupunta sila sa akin for fit to work. So I would just like to emphasize, it is not required among 5 years old and above, and among all of those: diabetes, smoker, immunosuppressive condition, malnourished, and multiple TB cases. Okay, so important pa rin in terms of screening ang symptoms, chest X-ray, and sputum findings. Okay, so after we have diagnosed, and then after we refer to healthcare services, the next thing to do is to establish a referral system, okay, to provide access to diagnosis and treatment services for its employee. So I don't know in QualiMed, but usually we have to have an arrangement with the nearest DOTS facility or direct observed treatment. The treatment for tuberculosis is actually free. It is available in our nearest barangay or healthcare center. And then the most important is the adherence to DOTS guidelines on the diagnosis and treatment is highly encouraged. So we must also have a monitoring team in case our patient, because the next slide will be the treatment. So I will explain why we have to monitor. So the standard treatment for tuberculosis is 6 months. So 6 na buwan. Actually, majority of people, pag hindi mo in-educate regarding sa treatment, they will ask why it is 6 months, because the risk of resistance is high. So I would just like to emphasize also that there's a difference in treatment in the first 2 months, as highlighted there, plus the last 4 months. So it is weight-based dosing. So ang ibig sabihin is the number of tablets that you have to take is depending on your weight. So marami pa rin nagtataka bakit iba yung 4, iba 3 tableta. So if you're more than 55 kilo, you will take 4 tablets. If you're less than 55, you will take 3 tablets. Pag medyo malusog, more than 75, you have to take 5. So medyo madaming iinuming gamot ng mahaba. So that's why we have to monitor minor and severe side effects. Why? Because I think the most common cause of non-adherence is having side effects. So we have to explain that some person will experience minor itchiness, discoloration ng urine, pag-iba ng kulay ng ihi, pero yung mga severe side effects like severe allergy and then jaundice o paninilaw ng balat. So we have to explain when to stop the drug, when to seek a medical consult, when to have other medication to stop the minor effect. Okay, so that is very important also. Okay, so since tuberculosis is an airborne infection, TB cases are usually contacted sa small enclosed spaces. So walang masyadong ventilation, maliit yung room, and then that's why most of the infection is happening sa bahay. I believe it is. When someone with tuberculosis, so sino ba ang close contact natin? Sino ba ang lagi nating kasama? Usually sa bahay, lalo na if there's no air circulation. So lalo na if that patient is symptomatic or ubo ng ubo, and then we're always having contact with that person. So that's a high risk for contacting the disease. So what must be done? In our setting, we have to apply disinfection devices, air filtration system, and open windows. O kung wala talagang magagawa, just like to advise yung mga patient ko sa bahay, just open the windows to facilitate air circulation. So I think that's more than enough to aid in decrease in tuberculosis, acquiring tuberculosis rather. And this is the most important slide among workers, employees, is that we must have a non-discriminatory policy and practices. So it must apply to all person, no discrimination in forms of hiring, promotion, assignment. So nagkaroon lang siya ng tuberculosis, due for promotion, so na-suspend yung kanyang promotion because of TB. We must always understand that tuberculosis is not different in any other illness. Okay, and we should apply proper compensation benefits. So I have a true story. A patient before came to me, and then I already write the fit to work. So the patient is already asymptomatic. It's been more than 2 weeks of treatment, and after that, after a few days, the HR called me if the medical certificate is valid, kung talaga bang pinapatrabaho ko na yung patient. I said, yes. Ang gusto lang pala niya malaman is kung nakakahawa pa or hindi. So of course, we should always apply this non-discriminatory policy among all of our workers, and what stated in the medical certificate is usually important. So I just formulated what are the employer's responsibility. So the employer, together with the workers, the labor organization, shall develop, implement, monitor, and evaluate the workplace policy and TB program. So just like now, we must provide information, education, training, and TB prevention, and we must always ensure a non-discriminatory practices in the workplace, ensure confidentiality of healthcare status among employees, and Health and Safety Committee, together with the labor organization, should review the policy, the program, continue to work with the government updated guidelines on TB prevention. and the employee's responsibilities. So employees shall practice non-discriminatory act against co-workers. Employees' organization is required to undertake active role in educating and training their member on TB prevention, and all employees shall comply with universal precaution and preventive measures. So I think this will be my last two slides. I just got this in the net. So according to DOLE, the Department of Labor and Employment reminded employees that workers who have tuberculosis must not be discriminated in the workplace. Workers who have tuberculosis shall not be discriminated. Instead, should be supported with adequate diagnosis and treatment in all stages of occurrence of TB. And then they will be entitled to work as long as they are certified by the company doctor as to medically fit, and shall be allowed to return to work as the illness is controlled. So I think this will be my last slide for the summary. Tuberculosis is a burden in our country, affecting our workplace and family. It is an airborne disease. It can be transmitted through inhalation, and persons with comorbidities have the highest risk of acquiring it. The lungs is the most common site of infection, but it can infect any part of our body. TB is curable, but needed 100% to adhere to medication protocols. So screening, diagnosis, referral, monitoring of treatment are the vital aspects in every institution to control TB in our workplace. So these are my resources, and thank you.
Thank you, Dr. Veracruz, for the very comprehensive lecture on TB in the workplace. For our viewers or our colleagues and staff, if you have any questions pertaining to the lecture, don't hesitate to message on the chat box your questions, and it would be gladly answered by our speaker. If you don't have questions, Dr. Veracruz, just to reiterate, I'll have a question so that the staff and other medical doctors would know that if the patient already had TB, is she at risk for having another TB?
Okay. That's why what they call this? That's why just I mentioned before the slides regarding the screening is chest X-ray annually. Annually you will have an X-ray, because there's a possibility that we can acquire a new tuberculosis. Okay, so all of us are exposed, especially in the hospital, among every people are commuting. Just like I said in the incidents, there's a high incidence of acquiring tuberculosis. So kahit na na-treat tayo for TB, we should always screen patients for having a new active disease, for having a new tuberculosis.
Thank you, Dr. Veracruz. It is very common that we have relapses of tuberculosis, and sometimes you have to be very aware that those relapses could also have multi-drug resistant TB. So if you have symptoms, you should immediately consult. We have another question, Dr. Veracruz. If the patient is ongoing treatment of TB, pwede po ba siya magpa-booster shot ng COVID vaccine?
Yes na yes. So the vaccine, just like any other vaccine, is actually not contraindicated. So hindi po bawal magpabakuna kung nag-undergo siya ng treatment for tuberculosis.
Okay. Another question, for the information of everyone, how long after proper treatment can one safely say that he is no longer infected, and what are the symptoms of relapse or resistance?
Okay, so Yan yung common na tinatanong lagi. So that's a very good question. Standard is 2 weeks. So for myself in the clinics, for example, I have a patient that is newly diagnosed with tuberculosis. So I will give treatment or refer to the TB DOTS program, and then I will ask the patient to come back to me after 2 weeks. And then I will ask, the very important is the symptoms. So how can we infect other persons? So we can infect them by through inhalation. So if that person already finished 2 weeks but still with coughing, still with productive coughing, and then difficulty breathing and other symptoms, so I will lengthen the leave of absence of that patient. But if the patient come back to me after 2 weeks, patient is asymptomatic, is doing very well, so I will give the fit to work. I will give the clearance.
How about, doctor, for those companies who require that the patient, especially those who require 1 month of TB treatment prior to fit to work? And yeah.
Actually, that's the one I'm always arguing about. So even though we pulmonologists will give the patient fit to work after 2 weeks, the patient is well, doesn't manifest any symptoms, compliant to medication, but sometimes they will come back to me for an SSS signing because their company wants them to leave for 30 days. So I think the most standard of this is 2 weeks. So it will depend on the doctor if the patient is still symptomatic or can transmit the tuberculosis to other coworkers. But the most leave of absence as usually I sign is 1 month. And then the other question is that that is no longer infective. The symptoms of relapse or resistance. Okay, if for example you have been treated for 6 months and then after that, okay na, there's no more symptoms, you gain your weight, no more coughing, and then after several months, and then you will develop the symptoms again. So I think it's better to have a recheck-up, and I think it's better to investigate among family members who among them are not been suspects for tuberculosis, because that's very important. If you actually have treated yourself but there's an index patient that is also having TB but does not have any treatment, so pwede kayo talagang mahawa ulit. Lalo na if you're confined to close sa bahay, kung masyadong walang ventilation, and then close contact, and then the patient is still coughing, so you can also have a relapse o pwede din kayo magkaroon ng another tuberculosis infection. And then the resistance, that's the role of the sputum studies. That's why after having symptoms, after having screening for chest X-ray, we will go to the sputum studies where we call the gene expert. So the gene expert will tell us if our medication will be susceptible, if our TB is susceptible to the first line of treatment. So, and then they will say if there's a resistance, so you have to come back to your attending.
For the information also of everyone, we have available MTB gene expert at QualiMed. So this is a sputum test wherein it could also detect not only the positivity of TB, it could also detect resistance to rifampicin. Do we have other questions? There is another question. Advices on healthcare worker on precaution on patients admitted for active TB.
So universal precaution. So you just have to wear a mask. That's it. So make sure that I think all of the rooms there in QualiMed has negative pressure. So just apply the air circulation, disinfection. For yourself, physical barrier is very superior. Just put a mask. So the risk for acquiring it through inhalation is very low.
N95 mask is advised.
So, yeah. I'm sorry. So N95 is tama, just like Dr. Ara said. So it's very important that you wear N95 mask.
Doc, good PM. Yung fibrosis po ba, hindi na po ba mawawala po talaga, lalo na sa X-ray? Thank you.
Yeah. So actually, majority of patients, lalo na if they start with severe tuberculosis, I would just like to give an analogy, Ma'am Jenny, is parang pag nagkasugat ka sa balat, if mas malaki yung sugat mo, mas malaki yung peklat. So it also applies to the lungs. So pag nagkaroon ka ng medyo malaking tuberculosis infection, usually pag naghilom sila, nagpo-form sila ng fibrosis. So wala pa po. So don't get me wrong, meron naman pong 100% naki-clear. Pero majority of patients with tuberculosis is nagpo-form talaga ng fibrosis or peklat. So yan po ay laging makikita sa X-ray nyo sa lifetime. Kaya importante ang annual X-ray to compare kung lumala ba yung previous fibrosis, kung lumaki ba or nagkaroon ba ng active na TB. Pero yung fibrosis is usually hindi na po nawawala.
I think there are no other questions or clarifications. So I think that's the last.
Doc, I have a question.
Yes, ma'am.
Yes. Doc, ano lang po, does it only take one whiff to be infected if your immune system is not strong? Does it only take one whiff of this TB para ma-infect ka?
Pino kami ni Dr. Ara, hindi pa man na-infect. And then, actually, just like I said, tuberculosis for me is a disease for in the immune system. Okay, your immune system is playing a part in progression or of not progressing the disease. So not all of people who acquired TB bacilli will get an active disease. Sometimes your immune system will protect you, but just like I said, if you have any other risk factors, just like tuberculosis or any other immune-related sickness, of course, mababang immune system mo, it is high risk o mas mabilis kayong mahawahan ng tuberculosis.
I agree with that, Doctor.
Thank you.
Sometimes at the clinic, even those who are partners, husband and wives, so some of them, hindi sila parehas mahahawa. Sometimes kahit very active yung TB nung husband, kahit positive pa siya sa sputum, the wife will not acquire the disease because of the good immune system.
Okay. Siguro, Doc, we'd like also to emphasize, according to Dr. Gina, that all information relating to employees, so lahat ng mga employees na nandito, kung tayo man ay may TB, it should be kept strictly confidential by your superior, and clinic medical personnel and medical findings will only be attached to the medical file. No, so dapat and very strict tayo na hindi dapat siya lumabas sa taat, and we protect the safety of our patients, employees, no? All right. Sige. Thank you, Dr. Gina. All right. And I'd also like to thank you very much, Dr. Marco and Dr. Arabella. Maraming salamat po for being with us and sharing your time with us. Also, props also to Dr. Mark Pasayan for inviting you to be with us today. Maraming salamat po. Again, so let me just share. Okay, hold it. Okay, so with this, we'd like to thank our doctors for being with us this afternoon, and we'd like to give you a digital, but we'll give you an actual certificate also. So in behalf of QualiMed Health Network, this presents a certificate of appreciation to Dr. Mark Gil S. Veracruz for his expertise and valuable role as speaker during the webinar entitled NTB, Workplace Policy and Program on Tuberculosis, given this 31st day of March 2022 via Zoom virtual event. Signed, Dr. Maria Gina C. Nazareth, Manuel Francisco T. Rojas, and Mr. Jaime E. Ismael, President, Chief Executive Officer of QualiMed Health Network. The same certificate we'd like to give to Dr. Arabella for moderating this afternoon session. Also, the certificate of appreciation is given to Dr. Arabella Pua-Quing for her expertise and valuable role as moderator during the webinar entitled NTB Workplace Policy and Program on Tuberculosis, given the 31st day of March 2022 via Zoom virtual event. Signed, Maria Gina Nazareth, MD, Manuel Francisco T. Rojas, MD, and Mr. Jaime E. Ismael. Again, so virtual clap naman, guys, for our doctors for being with us this afternoon. Maraming salamat again. Thank you, Dr. Ara and Dr. Marco. So everybody, so I hope we learned a lot of things now with this session. So, and to close the session, I just want to shout out everybody. We have about 172 ang pinakamalaki nating attendance this afternoon session. We hope to see you again in the 3 other sessions that we will have for our OSH web series. So to close this afternoon session, may I call on our Group Chief Operating Officer, Miss Margaret Bengzon. Ma'am Gaget?
Yes, good afternoon, Bambi. Good afternoon, Team QualiMed. And thank you again, Doc Ara, Doc Marco, for leading us in this session today. So important. I'd like to thank everyone, the QualiMed team who was attending and participated really actively in today's webinar. This is actually the first of a series that's focused on occupational health. And you know, we're all health workers, and by the nature of our work, we're very much focused on caring for our patients, but we often neglect, you know, the risks in our workplace that put our own health at risk. And, you know, I often think about this announcement that they make just before takeoff in an airplane, that you know, if oxygen masks are released because of changes in cabin pressure, they always advise us, put on your mask first before you try to help others. And this is very much the same situation. You know, we need to know, we need to understand, most of all, we need to practice how best to protect ourselves from occupational risk and hazards and of these, and there are so many really in the hospital setting, in order that we might be really in the best position to help and protect and care for the patients who are in our charge. So again, thank you again, congratulations for attending. We trust that it has been and will be helpful as you go about your daily work, and I really encourage all of you to make sure that you attend all the remaining webinars in this very important series. Thank you very much and good afternoon, everyone.
Thank you very much, ma'am. Thank you. Maraming salamat, everyone. Please have a safe trip home later in a while. So again, maraming salamat. Please join us in the next 3 sessions for our OSH webinar series.
Thank
Thank you,
you.
guys.
Thank you.
Maraming salamat.